Hello, everyone, and welcome. Today's training is titled Understanding of Behavior in ABM. This presentation is designed for mental health professionals who may or may not have formal training in applied behavior analysis, but who regularly work with behavior in clinical, educational, or community setting. So, the goal of this training is not to turn you into a behavior analyst, but to help you think behaviorally, apply objective reasoning, and ensure interventions are meaningful, ethical, and effective. So, what is behavior? In applied behavior analysis, the word behavior has a very specific meaning. Behavior is defined as anything an organism does that is observable and measurable. This includes walking, talking, writing, avoiding tasks, engaging with others, or even remaining seated. This does not include things like thinking, thoughts, emotions, or intentions, unless those experience are operationalized into observable indicators. Bear, Wolf, and Risley, in their foundational 1968 paper, emphasized that behavior must be focused on analysis because it allows for objective valuation. They stated that ABA focus on behaviors of social importance. In other words, behavior that actually matter in a person's life. This focus help prevent vague interpretations such as they are being defiant, she is anxious, or he lacks motivation. Instead, ABA asks, what does that look like in observable terms? So, this approach reduces bias and it improves collaboration and increases accountability in treatment. Why we measure behavior? Once behavior is clearly defined, the next critical step is measurement. Measurement allows clinicians to make a data-based decisions rather than relying on objective impressions or intuitions. Cooper, Heron, or Howard defined measurement as the process of applying qualitative labels to observe proper properties of behavior. In practical terms, this means counting how often something happens, measuring how long it lasts, and tracking how quickly it occurs, or documenting permanent outcomes. So, without measurement, we cannot establish a baseline, or we cannot tell whether the change has occurred, or we can evaluate whether the intervention is effective. For example, saying the client is doing better is not sufficient. Instead, we ask, is the behavior happening less often, or is it happening for a shorter duration, or is it happening, or is it occurring under fewer conditions? So, measurement protect both the client and the clinician by grounding treatment in observable evidence. Target behavior. A target behavior is a specific behavior selected for interventions because it impacts the quality of life of the client, safety, independence, or social functioning. So, not every behavior needs an intervention. AB emphasis on prioritization. Gaston explains that treatment goals should focus on behaviors that are meaningful and likely to generalize beyond therapy session or beyond therapy setting. How good target behaviors are observable, changeable, socially significant, and it aligned with clients' goals and context. For example, increasing on-task behavior at work, decreasing aggression or avoidance, improving functional communication, maintaining social or daily living skills. So these target behaviors should always be selected collaboratively, and it should we should consider the client, his caregivers, and other stakeholders. Operational definitions. Operational definitions. Once a target behavior is identified, it must be operationally defined. An operational definition describes behavior in clear, objective, and observable terms so that anyone reading it would know exactly what counts as a behavior and what does not. So, according to Cooper and the colleagues, a good operational definition must be clear, complete, and objective. Let's look at an example. A poor definition would be like client is non-compliant. So, in this definition, it is very subjective and open to interpretation. An improved operation definition would be, for example, client does not initiate the requested task within 10 seconds of a behavior instruction or of a verbal instruction. So in this definition, it specify the behavior, it defines the time frame, and it removes judgment, and it allows for reliable measurement. Clear operational definition reduce observer bias. It improve intra-observer agreement and strengthen treatment integrity. And it also enhances the ethical practice. So without them, data become unreliable and treatment decisions become questionable. Measuring behavior. So once the behavior has been clearly defined, the next step is selecting an appropriate measurement system. So in AB, measurement systems are generally grouped into continuous measurement and discontinuous measurement. The choice depends on the behavior, the setting, and the purpose of assessment. Let's start with a continuous measurement. Continuous measurement, which means every instance of the behavior is recorded. One common continuous measure is frequency. It's also known as event recording. Frequency refers to how many times a behavior occurs. For example, we might count the number of times a child asks for help during the class period. A related measure is rate, which look at frequency over a specific period of time, such as requests per hour. So rate is especially useful when observation times vary because it allows for more accurate comparison across sessions. Another continuous measure is duration, which refers to how long a behavior lasts from start to finish. And duration is often used for behaviors such as time spent on task, length of tantrum, or how long someone remains engaged in an activity. Latency is another measure. Latency refers to the time between a cue for instruction and the start of the behavior. For example, how long it takes a client to begin a task after being given direction. We also use inter response time or IRT, which measures the time between the end of one instance of behavior and the start of the next. IRT is useful when examining pacing or fluency, such as time between responses during a task. Finally, intensity or magnitude. It refers to the force or strength of the behavior. Intensity is often measured using rating scales and is especially relevant for behaviors such as aggression, self injury, or vocal outburst, where matters as much as frequency. Now let's shift into discontinuous measurement, which involves sampling behavior rather than recording every instance. So these methods are useful when continuous measurement is impractical. One discontinuous measurement is whole interval recording. In this system, the behavior must occur for the entire interval to be marked as occurring. Whole interval recording tends to underestimate the behavior, but it is very useful for measuring behaviors we want to increase, such as sustained engagement. Another method is partial interval method, partial interval recording, where the behavior is marked as it is occurs at least once during the interval. Partial interval recording often overestimate behavior and is commonly used for behaviors we want to replace. Third discontinuous method is momentary time sampling or MTS. With MTS, the behavior is recorded only if it is occurring at the exact moment the interval ends. This method is less labor intensive and is often used in classroom or group settings. So, in addition to direct observation method, there are other key measures used in ABA. One is permanent product measurement. Permanent product measurement involves measuring the outcome or result of a behavior rather than observing the behavior itself. Examples include a completed worksheet, clean classroom, or a finished work task. Another category is indirect measures, which include interviews, checklists, questionnaires, or rating scales. While indirect measures do not replace direct observation, they are valuable for gathering background information, assessing social validity, and guiding further assessment. So, selecting the appropriate measurement system is very essential. Accurate measurement system allows clinicians to detect real behavior change and it make informed decisions. And it helps to evaluate whether the interventions are truly effective. Behavior change. In ABA, behavior change is demonstrated through data. Baer and colleagues emphasize that behavior change must be demonstrated convincingly. This means comparing intervention data to baseline, or reviewing trends, levels, or variability, or using visual analysis to guide decisions. The behavior change may include increasing desired behaviors or decreasing problem behaviors or maintaining adaptive skills. So importantly, change must be clinically meaningful, not just statistically noticeable. So the question is not simply did behavior change? It is did the change improve person's life? Social validity. This brings us to social validity, one of the most important and sometimes overlooked concept in ABA. Social validity refers to the importance of the goals, the acceptability of the procedures, and the value of the outcomes. So Wolf argued that ABA must focus on whether goals are really important to the people who are affected. So social validity asks, are we targeting behavior that matter and our interventions are acceptable to the client and the caregivers? Do outcomes improve the quality of life of the client? So social validity is assessed through interviews, rating scales, stakeholder feedback, or client self-report when it is possible. So without social validity, even technically effective interventions may not be ethically questionable. Ethical considerations. Ethics are embedded throughout every step of behavioral practice. So without social validity, even technically effective interventions may be ethically questionable. Ethics are embedded throughout every step of behavior practice. The BCB Ethics Code requires behavior analysts to prioritize client dignity, obtain assent when possible, and use least restrictive procedures and focusing on socially meaningful outcomes. So, the ethical practice means selecting appropriate target behaviors, avoiding unnecessary control, respecting autonomy and preferences, and monitoring for unintended effects. So, measurement, operational definitions, and social validity all support ethical decision making by ensuring transparency, accountability, and respect. So, to summarize this training, behavior must be observable and measurable. Measurement enables data based decision making. Clear operational definition improve reliability. Behavior change must be demonstrated through data. Social validity ensures interventions truly matter. Ethics guide every step of this. So, whether you identify as a behavior analyst or not, these principles can strengthen your clinical work and improve outcomes for the individuals you serve. Thank you for your time and attention.